and public awareness of the importance of early childhood, which is of course what we're doing this morning. The State Board is also responsible for system development and the funding streams for which we have authority. Amanda, if we put up the chart on organization. This is what our organizational structure looks like. The ECI board is made up of 16 citizen members that are approved by the Senate and appointed by the governor, as well as department directors from state agencies. Ex officio members include 2 members of the Iowa House, Representatives Mary Masher and Mike Bergen, and 2 from the Senate, Senators Chris Knoyer and Claire Celsey. Now, by state code, we report annually to the governor and the legislature, and our 2020 report will be distributed in January, and I think most all of you on this call will be receiving that electronically. It will also be available on our website, the Early Childhood Iowa website. Now, the board understands that the COVID pandemic will be front and center when creating the upcoming legislative agenda. And to that end, we believe it is important that we do our part to make sure that you know how early childhood figures into the entire calculus. Now, most of you are familiar with the United Way's efforts to address poverty. And man, if we slip onto the next slide here, they use this term ALICE to represent all those in our community who are asset limited, income constrained, and employed. Now, ALICE is not an individual, of course, but a conceptual blending of all those things and all those people in our community who bring home a paycheck that's above the poverty level, but doesn't stretch to cover household needs. Now, the main thing that I wanted to show in this slide is the percent of expenditures that a young family has for childcare. You can see that in this particular case, the way that they've defined it, it's the biggest slice of the pie in terms of a young couple's income. Now, it's important to note that these are people who can afford early childcare. They struggle to do it. It doesn't include the 105,000 plus Iowa children who live in poverty. Now, these numbers perhaps don't reflect most of us on the Zoom call this morning, but these are hardworking Iowans who need our help. So while there are good things happening for Iowa's youth in terms of the overall well-being of children, many charts have shown us is in the upper tier of how we're dealing with children in the early stages. There's a dramatically decreasing trend in teen birth rates, and we top the nation in high school graduation rates, but we're falling short in support of our youngest. Consider that Iowa has lost 37% of its child care providers over the last 5 years. And estimates show that there is currently a shortfall of 350,000 child care slots. And there's the possibility that another 51% of our child care supply could be lost due to the pandemic. Now, if you would like some more details on the impact of Iowa's economy based on the loss of childcare, check the Iowa Association of Business and Industry website. I spent some time there the other day, and there's a wealth of information provided, catered towards what the impact on business is going to be in Iowa. Well, the Early Childhood Iowa Board is collaboratively working with agencies across the state to advocate for and empower the professionalism of early child care workers and the resources necessary to maintain this vital industry in the state. Our presenters this morning are going to give you a brief overlook behind the curtains of what we are doing in support of Iowa's youngest people. So again, we're time constrained this morning. We'll try to make some time for questions for each of our presenters, but we'll see how things go. First on deck are Jillian Hernick and Ashley Ott from the Iowa Association for the Education of Young Children. Jillian?
Good morning. Thank you, Rich. Appreciate the time today. As Rich said, I'm Jillian Hernick with Iowa AYC. And go ahead and stay on the first slide if you would. I like the slide. You have the child care provider there holding up the rest of the industry. We know that the child care workforce is truly the workforce behind the workforce. making it possible for Iowans to go back to work, or in our case, currently to return to work. We do know that prior to the pandemic, Iowa had the highest percent of parents with children under 6 in the workforce, and also the lowest unemployment rate, close to the lowest in the nation. Quality childcare, as Rich mentioned, was already difficult to find and afford with a large number of childcare deserts, especially in our rural Iowa. Just under a year ago in February, the U.S. Chamber of Commerce Foundation released a report. We worked with ABI on that, called Untapped Potential, and it studied that economic impact that the breakdown of childcare could cause in Iowa. And they estimated in that report that that was a hit to Iowa of $935 million as a loss, which results from turnover in employment, but also loss of tax revenue. Bring us to today. Amidst a pandemic, childcare is even harder to find and more necessary as Iowans try to go back to work and Iowa's economy starts to recover. The stimulus money from the CARES Act really helped keep many childcare homes and centers operating, but the money hasn't necessarily trickled down to the workforce. The childcare workforce historically has made the bottom 3 to 5% of earners. And for a long time, as Rich mentioned, that we have had in Iowa, people leaving the field at alarming rates. So I'm going to hand it over to Ashley to talk a little bit more about data and solutions.
Good morning, everybody. I'm Ashley Oddie. Thanks for the opportunity to be with you this morning. I want to just pause a minute here on what has become my favorite infographic as of late, and it's the hole in the bucket reference. The workforce really is, as Jillian said, the foundation upon which we're building quality childcare, and it is extremely difficult to work towards quality for our youngest children when we have a workforce whose median wages range from $9.20 to $11 an hour. Referencing the Alice report, we know that about $15 an hour is a livable wage in the state, so our childcare workforce is well below. In addition to that, nationally, the estimate is that over 50% of the childcare workforce relies on public assistance of some kind. So we are asking these folks to do very important work, building the brains of our youngest citizens, paying them abysmally, and not supporting them in the ways that really is going to help us get to quality for everyone. Because this work pays so little, little formal education is held by this workforce. So we have sort of a myriad of issues. But as you can see in the infographic, as we continue to pour resources into childcare, they're flooding back out as the workforce continues to turn over. Next slide, please, Amanda. So I wanted to talk with you just briefly about a couple of strategies to address some of the issues that the workforce face. And those two strategies are Teach Early Childhood Iowa, which is a scholarship program, and Childcare Wages Iowa, which is a salary supplement program. So both of these programs were designed based in research to address chronic issues that we see in the childcare workforce, specifically related to education, compensation, and high rates of turnover. So both of these programs have structures in place to address those issues. Teach provides a mechanism for this workforce, who are primarily women, to earn higher levels of formal education, which we also know helps them provide higher quality care to the children that they're serving. In addition, it provides them with compensation increases, because we know that even though perhaps in other industries, when someone obtains a degree or a credential, they earn a raise, that isn't always true in childcare, but Teach does build those pieces in for the workforce. We also require a commitment. So the rates of turnover for Teach recipients are much, much lower than we see in the workforce as a whole. So the workforce as a whole in the state of Iowa is estimated to turn over at a rate of about 28% a year. You think about that in terms of one kiddo in a classroom and how many new teachers that potentially can be. And as the work of early childhood is forming attachments, That's a significant struggle. It's also very difficult to obtain a QRS rating or work towards NACE accreditation when you have a constant new crop of staff in your program. So the turnover rate for teach recipients in the state is closer to 7%, much, much lower than we see across the board. So I want to highlight some outcomes for you. The thing that is important to keep in mind about teaching wages are that these are evidence-informed strategies that have a long-standing track record of very strong outcomes. They're on the shelf, they're ready to roll or be expanded at any point. So in the last year, we had 367 teach recipients who earned 76 credentials and degrees in early childhood education. Our retention rate this last year was 93%. So only a 7% turnover rate, again, compared to 30% across the state. And those folks saw an average hourly wage increase of 11%, which is significant compared to the rest of the field who sees maybe 1 to 2% cost of living annually. Again, on a $9 to $11 range in hourly rates. Childcare wages then is the sister program to teach. And wages, once someone has earned the education we want them to have in early childhood education, wages then continues to reward them for the education that they've earned and also the commitment that they've made to their program. So for every 6 months they remain employed, they receive a salary supplement that is tied directly to their level of formal education. Last year, we had 292 wages recipients. Their rate of retention was 84%, not as high as teach, but again, better than the average. And those average 6-month supplements were over $900. I think the advantage in terms of wages, although it does not factor into someone's hourly rate of pay, is that for someone who is living at or below the poverty level, an average of a $900 check every 6 months allows those folks to do things like put new tires on their car, or do a home repair, or move if they need to move, to address some things that their monthly income does not allow them to do. So know that Teach is a statewide program. We've been statewide since 2003, but wages is only available in 38 counties in the state. And the availability of wages is tied to funding availability. So as Jillian said, as we think about the pandemic and we think about what's happening with the workforce, what was happening with this workforce prior to the pandemic, they were not in good shape. And the pandemic has exacerbated that for these folks. There has been support to childcare businesses that has not trickled down to members of the workforce. So if my center got a stipend to help keep the doors open, if I'm a teacher in a center, I didn't necessarily get any additional support. So I anticipate we will see more closures, we will see more people leaving the field, and it's really a critical time to be able to support the workforce. And these are two really evidence-informed strategies with which to do that. And I just have one more slide for you. This is our success story for this year. Her name is Kenya. She is a first-generation college student who works at a center with high rates of childcare assistance. So a lot of folks at the poverty level, and she has one class to go before she finished that associate degree and is very excited to move on to her bachelor's. We're super proud of Kenya and all that she's done. And we know that these programs work. So I'll be happy to answer any questions that you may have. And if not, that's it for me. Thank you.
Well, we really appreciate the scaffolding that you're providing for our early child care workers. And I would imagine that one of the things that also happens is that we're able to retain more Iowa students and people and kids getting out of college here in the state rather than seeing them hemorrhage out of state. Great. Thanks, Jillian. Thanks, Ashley. Next up is Dr. Heather Rouse from Iowa State University, my alma mater. Take it away, Heather.
All right, thank you. Thanks for the introduction, Rich. And wonderful to be able to speak with all of you for a few minutes today. I really love following Ashley and Jillian because the work they're doing is really kind of this epitome of our building our systems of systems, right? I mean, as you heard from Rich in the beginning, early childhood is complex. You know, it's not just about the kids, it's about the parents. And then if it's about the parents, it's about the workforce. And if it's about the workforce, then it's about the businesses. And it's really complicated sometimes to understand how all of our programs are working together. And when I hear Ashley and Jillian talk about, you know, programs that were built based on evidence and programs that were built based on understanding what Iowa needs are, that's when I get really nerdy and excited about what I'm going to share with you today. So in my mini minutes, what I wanted to share with you is progress on our development in the state of Iowa of an integrated data system for decision making. Next slide, Amanda. As you've heard, our systems are complex. We have challenges that just continue to exacerbate, especially in the midst of COVID, right? Understanding implications of unemployment on children's well-being, understanding where our children are going if they're not in childcare. What are they doing? Where are they going? How are our hospitals dealing with outbreaks? And what's happening in our childcare systems with the crisis, with the workforce challenges? Next slide. So what we have done with integrated data is we've built on a vision. Back in 2015, ECI's strategic plan included an inventory of all the data across our systems, because we were at this point where we said, okay, we know we're doing a lot of really good work, but we can't see it all at the same time. Right? Data are siloed. We collect information in our health systems. We collect information in public education. We collect information about our workforce. But when we have a question about how they interact or how many children are being served across our programs, we couldn't answer that question. So over the last 5 years, we've been working on developing an integrated data system that now is formally called Iowa's Integrated Data System for Decision Making, I2D2. So if you hear the acronym I2D2, this is what we're talking about. This system was built with a vision to have more comprehensive cross-system information to be used in collaboration and discussion about how we move our programs forward. So just like Ashley and Jillian were talking about the workforce, we want a system to be able to inform how can they expand teaching wages? How can they reach more families? How can they reach businesses that are ready to take on more of the workforce? This is what we hope I2D2 can be able to provide for you. So with consultation from some national experts, we partnered with a national network of other integrated data systems across the country to build I2D2. And we really wanted to focus first on making sure this system was designed to serve Iowa priorities. So it really does front and center say, what are our priorities? What do we need to know? How can we identify gaps in our system? How can we enhance our cross-system programming? And how can we support ongoing cycles of inquiry? So I'm going to go now down into the weeds for just a minute and explain to you how this system works. So essentially, as I mentioned, our public systems collect a lot of data, right? We don't necessarily need to collect more data. We are just creating a system where we can use it differently. So when children enter programs, families use services, programs refer families to other services, administrative records are created in those different systems. Most of the time they stay in their own silos though, and we don't have capacity to see where families are across systems. But with I2D2, we bring those administrative data together, we integrate them across systems, and we use it to generate knowledge about families and children. We then engage in a series of dialogue, discussions with folks. We talk with folks in the workforce. We talk with folks in public education and health. We talk with your ECI local area directors, many of you which are on the call today. We engage in data discovery sessions where we think about interventions and strategic planning, and then try to use these data to inform decision making. Now, the thing I love about I2D2 is that it's not one study. It's not designed to do one study. What it's designed to do is cycles of inquiry, so we can keep going. So when you have a program like Teaching Wages and you want to roll it out and you want to say, did it work? Did we reach the people that we think we can? we can continue to study that with those administrative data because they're longitudinal, they're coming from those systems that are serving children and families, so we can keep understanding how we're improving our systems over time. Next. In the last year, we have had a series of studies that have come out of I2D2. And I say studies because I say these are cycles, but these are reports and briefs that have come out of some of the work that we've done. We helped support the Early Childhood Iowa Statewide Needs Assessment that was completed in 2019. And that was really exciting. That was one of the first times we were able to say, okay, for example, how many of our 4-year-olds have an experience in a center-based care? How many of them have preschool? How many of them go to Head Start? How many of them participate in a center-based care that's subsidized by CCA? We could pull all those data together and capture for the first time unduplicated counts of kids across systems. And not only understand who's in, but perhaps more importantly, who's not being served by our programs, and where are there opportunities for us to think about outreach, access, or maybe workforce. You can see, I'll leave you today with our website that was just rolled out, but you can access any one of these reports and briefs from our website. Here's a highlight of something that's really taken us into 2020. Oh, go back, thank you. That's really taken us into 2020 with some local discussions. The thing that's neat about these data, because they're coming from administrative data systems, we can take a statewide look, but we can also drill things down and aggregate them at county levels or by public health service areas or by local school districts. So on the next slide, you'll see where we were able to take this indicator of participation in a 4-year-old center-based program and drill it down by county. So we can see where there's differences in families participating. Now we know there's an element of choice here, right? Families can choose if they want to participate, but this gives us a first snapshot to say, oh, there's areas where children aren't participating as much. There's areas where children are participating, right? Some of our counties, only 2 or 3% of the kiddos are not in some kind of center-based care. That's interesting to know. That's interesting to know where they're at. Now we can drill down on this a little bit further. So this has been a good piece of discussion for some of our local areas as we think about what other information does folks need to make decisions at local levels. And what information do we need at the statewide to be able to inform our results areas that we care about for ECI, other priority areas that have been identified across health and education and other areas. But we're not done, right? Just as a true nerd, I will say that as you answer one question, you basically generate about 6 more. And that's the exciting thing about I2D2 is that we can keep studying, we can keep asking questions and think about, okay, well, so you looked at 4-year-olds. Well, what about 3-year-olds? What about 0 to 3? What happens for those kiddos? Maybe there's kiddos that are in multiple programs. Okay, great, we can look at that next. So next slide. So here's some questions that we've been wrestling with as a group, and I say as a group with these stakeholder meetings that we've been having over the last year. These are some of the questions that are bubbling up. Well, what about those children who experience multiple programs? How do families transition between programs? What about other core services? What about nutrition? What about mental health? That's a big one right now that everyone's talking about, right? Are our home visiting and family support programs preventing maltreatment like they were designed to do? These are all questions that we can answer now with I2D2 capacity. So we're really excited to move forward on this. And in the next slide, I'll share with you what some of our priorities are moving into 2021. But these priorities are identified based on what you need. So this is where we need to hear your voice. We need to hear you say, here's what we need to be focusing on. For Iowa, here's what's important. We know COVID implications are very broad, right? We know we have workforce challenges. We know we have mental health challenges with parents and children that we may or may not be able to uncover, but we need to figure out ways to think about that. So here are some of the priorities that we've already identified that we know we're going to be focusing on this coming year. Understanding more about childcare access and preschool access, drilling down more into the 0 to 3 population and understanding families that are receiving home visiting and family support services, and studying school readiness and school success. How do our kiddos transition into public school, virtual, home, or in person? As we know, those realities are changing. So with that, I would love to leave you with our website. Amanda's going to share with you a couple of the policy briefs that have recently come out. And you can find all of those on our website as well. And please send us feedback. As my mentor likes to say, consider this wet cement. Nothing's nailed down yet. Give us feedback. Let us know what else you would like to hear about. Help us think about priorities. Help us think about data systems that aren't yet connected with I2D2 that you think are high priorities for the state of Iowa. And we would love to have those conversations. We think I2D2 is a system. It's not a database. It's not a computer, it's people. And so we need to come together as people, help us think about how we can best serve you as an ECI community. And with that, I will leave for any questions or pass the baton to my next partner.
Well, thank you, Heather. You know, everybody, I think, needs a data nerd in their organization, and Heather is ours. This is work that we could not have done. And I think one of the greatest things that's happening here with this work is the needs assessment was information that we really needed for us to be able to do a good strategic plan that was built on metrics, and we now have that. I think as we look at the data, it makes us all more informed. And as I'm listening to you talk, Heather, I think that this, I don't know if anybody is on from LSA, but this is the kind of information that those folks could use too to drill down into data to provide legislative information. So any quick questions or comments on Heather's presentation? If not, we're going to move on. Our next speaker is Dawn Oliver Wyan from the Iowa Women's Foundation. Take it away, Dawn.
Good morning, Rich, and hello, everyone. I'm excited to be with you this morning, and I do recognize that many of our community partners are on the line with us today. And please know that the work that I'm about to share with you, we would not be able to do if it wasn't for those community partners. So thank you all so much. So as you all know, and we can switch, Amanda, to the next slide, the Iowa Women's Foundation has been working to increase the availability of quality, affordable childcare across the state of Iowa for the last couple of years with all of our community partners. And we're doing this because of our research and our community conversations that we've had across the state. And we know, as you've heard already mentioned today, and I will mention again, that according to Iowa Child Care Resource and Referral, 75% of Iowa's families with children under the age of 6 have all parents working outside of the home. Iowa is #1 amongst all states. On average, 1 in 2 children go without access to quality, affordable childcare. And in the past 5 years, leading up to the pandemic, Iowa has lost 33% of its childcare businesses. We cannot continue to lose them at this rate. We also took a look at the economic data because we believe that childcare is not just a family's issue anymore. It is an economic issue, and it is an economic driver for recovery in our state. And as Julian referenced earlier, I'm going to share a little bit more with you some of that data that came out of the U.S. Chamber of Commerce Foundation report that really helps share with you that this is an economic issue. Annually, childcare issues result in an estimated $935 million loss in Iowa's economy every year. We lose $153 million annually in tax revenues, and our businesses are losing $781 million a year because of absences and employee turnover. We knew that we had the data, it showed it to us. We needed to start creating some action. And how are we going to work on this? And how are we as a state and community partners going to impact the child care issue? So the Women's Foundation with our partners started the Building Community Child Care Solutions Collaborative. This collaborative is the only program of its kind across the state. Right now, we have 30 communities with over 650 volunteers working together to increase awareness and explore innovative ways to address the child care crisis that we're seeing across our state. We know that if we can come up with these solutions, we're not only going to be supporting our families, but we're also supporting our businesses and our communities, both in the short and the long term. Solutions include everything from building and expanding, getting businesses involved in childcare, our childcare workforce, before and after school program and summer care, community college partnerships, and innovative ways of addressing childcare for the second and the third shifts. How are our communities doing this, and what are some of the things that we're working on? We are, as I said earlier, working with our communities across the state, but we've also formed a business and childcare coalition. We have representatives from 15 of the largest businesses across the state coming together to put together tools that businesses can use to increase support to their workforce. We also are working with the childcare entrepreneurs, as we like to call them, or our providers, our business owners, because we want them to have the support they need to be stable and to grow and expand. We're also looking to increase community awareness. We need people to see that this is an economic issue, and this is an issue that we need to work on together. So we're working on that. We're also working on grant making. We're putting our money into this effort, not only our efforts, or not only our actions. We've invested over about $120,000 now with the support of Casey's to build two programs that are increasing the availability of childcare. And finally, we know that we can't do this work without policy. So we're looking at both national policy and state policy. We're working at the national level with our elected officials to look at ways that we can make sure that childcare is included in the recovery and the stimulus packages. Good news, the one that was just signed over the weekend does have childcare in there. And we're looking forward to moving that forward and to working with our partners to do that. But we also need to look at statewide public policy. And I'm so excited to share with you today that the Women's Foundation, along with 9 other childcare advocacy groups across the state, came together this year and worked on an aligned message and policy recommendations moving forward. So hopefully we're all going to be talking the same talk and walking the same walk as we move forward in 2021. And I wanted to share with you just briefly what those policy recommendations are that we have, as a collaborative, have put together and are going to be recommending. Number 1 is we need to provide funding for a public-private partnership with the purpose of stabilizing and growing the childcare industry. We can't do this work by ourselves, and one organization or one group of people can't. It is going to take state dollars, federal dollars, business dollars, and philanthropic dollars to really create a public-private partnership that's going to address the economic recovery that we need and the role that childcare plays in that economic recovery. We also would like to recommend that we increase funding to adequately support and expand wages statewide. As Ashley shared with you, it's only in 38 counties. We would like to see it in all 99 counties. We have a plan. We know what this is going to cost. And if we can come up with that money to expand statewide, the money that's being used right now to support wages could go on to other strategic supports. We also want to see and reinstate the before and after school grant program that was established in 2007 to create a state funding stream for quality before and after and summer programs. I think now with COVID, we've really shined a light on the importance of before and after in summer school, much more than we ever have before. And we really need to see if we can help fund these programs so they can become even stronger and more expansive across our state. I was surprised to learn that in many of our communities around rural Iowa, there are no before and after or summer school programs. Kids are going to the libraries or they're hanging out on the streets. We need to change that. We also would like to see that we increase the child care provider reimbursement rates for CCA to the 75th percentile of the 2020 market survey for all providers participating in the QRS program. And finally, we hope to increase child care assistance entrance income limits to 185% incrementally at 5% annually. So those are the recommendations that will be coming out that we'll be looking at in 2021 as we really work hard to bring back the childcare industry better and more stable as an economic driver. And I'll be available at the end to answer questions as well. But for now, we'll turn it over to the next person on the list, Rich.
Thank you, Dawn. You know, just thinking of a couple of things while you were speaking. One is the collaboration of organizations across the state that are working with ECI to try to make things right for children in the early stages. So I was thinking of the Lorax and how Dr. Seuss talked about the Lorax, saying that, you know, the trees could not speak for themselves. So the tree, he spoke for the trees. And I think that these organizations in that same way are speaking for the children of Iowa. And the other thing with the Iowa Women's Foundation is, you know, this is an organization about women, but I appreciate so much that the Women's Foundation has taken time out to work with children, because of course children, the care of children is so tied up with the welfare of women, as we're all recognizing now, especially with the pandemic and the way that women's lives are being disrupted perhaps more than others. So thank you, Don. And any questions right off the top or comments on Don's presentation? A lot of shy people on board today, but we'll have some time at the end perhaps for questions and comments. Next up is Jennifer Huber. She's the director of the Family Support Services at Saida Community Action Agency, I believe, Ottumwa. Am I right, Jennifer?
Yes, Ottumwa, based in Ottumwa, yes. Okay, so family support programming, sometimes I feel like it's the forgotten component when we're talking about meeting the needs of our young Iowans. So the goal of family support home visitation programs is to equip families for long-term sustainable success through educating, guiding, and supporting them. These are families who, without this assistance, would most likely remain dependent on some sort of state financial assistance throughout their lifetime. Family support programs use evidence-based and strength-based models and practices to help families achieve self-sufficiency, financial stability, and healthy family functioning. So if we look at the two parts that we are talking about today with family support, we look at the science part and the art of family support, and there is an art to it. So the science part is about prenatal and child development, early brain development, and how important this is, especially the prenatal part. We really look to enroll folks prenatally or soon after their baby is born. And this is all having to do with education and the foundation of making strong families. ACEs and family dynamics go together really strongly in this program. So ACEs are adverse childhood experiences. These can be things that the parents experienced growing up, such as neglect, abuse, any sort of disruption in their life. Even divorces can be an adverse childhood experience. In family support programs, we really like to address those. So, you know, there are many adults in our programs don't even realize they have these. And we also want to prevent any more happening to the children in our programs. These all stem from the childhoods of the parents. And we really focus on this to promote attachment and family, parent-child interaction in our programs. When families are ready to exit our programs, we want to make sure they're in a place where they understand healthy relationships, they can maintain them, and we really like to make sure protective factors are in place. This is making sure that they have social skills to be independent, that they choose positive people in their life, that they have a belief that they are capable of controlling their own lives, and they have confidence in their ability to parent and function independently, and that they have their values and priorities in a good place, putting their children first. So doing all this takes a little bit of a special type of person. These families are allowing themselves to be vulnerable in a way they maybe never have. And sometimes they are very, sorry, you stay on that one. I'm still talking about the art. They sometimes are embarrassed. It takes a special person to do this job, and it is a difficult job. They have to be able to connect and engage with these families, sometimes on a long-term basis. They have to build the trust and relationship with these families. They have to walk the line between empowering and enabling, because people who are in this field just really, really want to see people succeed so much that it's hard not to do it for them. And we make sure that we do not. We empower them, we teach them, we wait for them to be ready to move to the next step. We make sure we refer to the right places and that we do it kindly and warmly. We do not just give somebody a phone number and say, call this person, they will help you. We make sure that that person knows to expect their call, or we make the call with them. We always meet the families where they are. We have families at different levels of need. We meet them where they are, and we use their strengths to make them more successful and independent. These bonds are very strong between their workers and their families. So strong, this will speak to it. We've had no families in our programs stop services due to the switch to virtual services. We've had nobody has quit. They are waiting for those workers to come back into their home. They're just desperate to have them back. In some cases, the connections with these families has grown stronger since it's virtual. We have more contact with them. They reach out to our workers more often than before. That really speaks to how well workers bond with these families. Next slide, please. So how does this translate into the financial side? So as I said, we really focus on that prenatal health, getting prenatal care, the doctor visits, creating, a safe environment for baby to come into, the health and safety and nutrition of the mom. And so women that are enrolled in our programs, it has been shown there's a 37% reduction in preterm births when they are enrolled. Why is that important? Well, if you look at the following numbers, an average NICU stay costs over $280,000. If we can prevent a preterm birth, then we can prevent NICU stays. If there is a preterm birth, there can be issues that need early intervention, such as the AEA. Those cost an average of $45,000 a year. And sometimes those are needed for 4 years. Also, then with special education needs, those can continue. It's $28,000 a year, or if they need it throughout their schooling, that equals $364,000. And this is just for one child needing extra assistance in school. In contrast, the average cost for home visiting services are $4,000 per year per family. Even if a family remains in family home visiting for 5 years, which is the maximum, or until kindergarten entry, the most that will be spent on that family is $23,000. So if we can reach this family prenatally or very early after birth, we can prevent a lot of cost to the state. It's a true investment in people and financially. I think sometimes it's forgotten that preterm births can cause lifetime costs, and they're preventable. They're preventable if we can reach these folks early enough. Next slide, please. So quality of these programs matter. And in our programs, we make sure we are accredited. We make sure we are affiliates of the models that we follow. We have ongoing training for staff that is sometimes costly. So the impact of flat funding is already being felt by local ECI boards who have to make decisions on how they allocate their money. And they allocate their money to entities that they serve. And in turn, then the agencies have to decide how to allocate what they were given and how to spend that in their program. So as costs increase, of course, what is impacted the most are salaries. And it's just really important that we have the right people in these positions. And the turnover, we don't want turnover. We want to retain these people. They're in it because they love it. They have a passion for it. Turnover hurts agencies, and more importantly, turnover hurts the families we serve. These families bond with these folks, and turnover just causes disruption in services so much that, you know, sometimes families just don't continue because they really were bonded with that worker. When we bring new staff on, it is an investment to get them trained, both in-house and through the national trainings that are required, which is just money that could be saved if we could retain those folks. And the number one reason for turnover is wages. We have to continue to be able to give these folks livable wages, and they deserve raises. So that is the largest impact of flat funding locally. We have great ECI boards in my area. They do listen to what we want. They listen to our wish list. But again, if we want to increase salaries annually and give even a modest wage increase, we have to make those hard decisions about which part of the budget they'll come out of. So this really is an investment, and these programs work. They really work. I'd like to share a story of a current family that we have. That would be next slide, please. We have a family that's currently enrolled in our McV program, and they have been for 2.5 years. Now, when they came on, mom had 2 children, and she had a 3rd baby on the way. She enrolled about halfway through her pregnancy, and dad was at a long-term residential facility. There was every issue you could imagine at the time: substance abuse, mental health issues. There were criminal charges. There was an OWI. So she enrolled, and dad returned home. And in the 2.5 years that they've been enrolled, mom gave birth to a healthy baby. She was able to breastfeed, which is indicative of her being clean and sober. Dad completed treatment, moved home. Dad is gainfully employed, still is. Mom did work for a while, but had to stop working because of the pandemic and some childcare issues. But what I want to share with you is that when they came in, they were on FADs, they were on FIP, they were on food assistance, they were on WIC, they were on Section 8. And currently they are in McV, and they are only on WIC, which is a testament to the support that they were given through family home visiting programs. Financially, that is a savings of $46,000 to the state over the last 2.5 years, just for 2 years of family support programming. We would love to continue to help more families. We cannot help more families with our current funding, and we would really be disappointed to not be able to help as many at this quality level of care that we give them. Home visitation is my passion. I'm sorry I keep pausing, because it is. I just wish more people knew about it and more people had the opportunity. And I still am amazed. People ask me what I do, and when I explain it, they've never heard of it. And I want it to get to a point where people know about it, just like they know about preschool and Head Start. And it just has so many impacts. I would love to see it grow bigger. Thank you.
Well, thank you, Jennifer. I think it's interesting that you pointed out the art of childcare. Jennifer, or Heather's got the the science part down. We have some of our pictures of the ECI logo, and some of them have the hands supporting that logo. And what I see here is that we're taking every possible aspect of early childcare and making sure that it's accounted for, both scientifically with the numbers and also physically with the touch. Just real quickly, Jennifer, could you talk about the quality of virtual visits? Has the quality been there? You've talked about many people wanting to get back to the one-on-one, but has the virtual visit worked?
The virtual visits have worked. And when I say that they're wanting to get back to the one-on-one, I mean, of course, we all do. We're human. We want to sit in a room with somebody and interact. But the staff have been so creative in the way that they continue to do these sessions. We've been able to drop supplies off on porches, and then the staff member will have a book and the child will also have the book. They read it together. They have just been so creative in the way that they maintain these visits and make sure they're maintaining the parent-child interactions. We really haven't seen any discord or disappointment, or they've really been great. Everybody has, staff and clients have just done great with it.
That's good to hear. Again, another thing that probably, although we will go back to one-on-ones, that ability to start to use the virtual visits is going to be valuable in the future.
Absolutely.
Right on time. Next up, Sarah Welch and Suzanne Minnick from Mid-Iowa Health Foundation. You're up.
Great, and I'm Sarah Welch here representing on behalf of the Iowa Alliance for Healthy Kids and in Suzanne's place as well today, but really excited to talk with you about a partnership with Sesame Street. And if you go to the next slide, I'll introduce it. So we know that children, we've been talking today about how children need certain things to learn and develop, and providing these building blocks early in life is critical to their lifelong health and well-being. But this effort cannot fall on parents alone, as we've been talking about. It really needs a system of support. So many parents are dealing with a lot, especially right now, and sometimes the weight of it all can make it difficult to give children everything they need to grow in the best possible way. We must wrap around our families and reinforce their ability to lay a strong foundation for our kids. Sesame Street has an amazing ability to talk about hard topics like trauma, homelessness, poverty, grief, and inviting parents and providers to learn how to have these conversations and to use their resources to support those interactions with kids so they can address some of these challenges head on. In essence, we can create the neighborhood that's needed for our kids to develop in the best way possible. Over the next year, our state has a unique opportunity to partner with Sesame Street in communities with a focus specifically on improving social emotional well-being. And social emotional well-being, whether it's social emotional learning, social emotional development, it's a term that we hear thrown around often, and it's really hard to define. But we increasingly know that helping kids with skills like naming and managing their emotions, showing empathy, building positive relationships, and making good choices are all skills that are important for their learning and growth. So by focusing on these skills now, we can help kids establish lifelong mental health, prepare them to be fully contributing members of our workforce and communities. And it's an opportunity to lessen the impact that the pandemic has had on children, especially as more young kids are isolated and living in stressful situations during this crisis. So thanks to a major grant from the Kellogg Foundation, we are lucky to receive Sesame Street and Communities' full expertise, creativity, resources, and of course their well-known brand and characters, and to be able to work intensely with them over this next year. Central Iowa is one of just 12 communities that are working with Sesame Street across the nation. So we're really on the front end of their work in communities across the US. If you go to the next slide, I'll share a little bit just about the goals and what we're doing with this project this year. So thanks to many amazing partners that are making this happen under the Iowa Alliance for Healthy Kids. Stakeholders from several organizations, including Early Childhood Iowa, have been working hard to develop an action plan for the next year and to work to build these connections across our region and our state to really carry out this work effectively. Our focus is on Central Iowa in the first year through the summer, but then we are quickly looking at how to expand some of these resources and support statewide, knowing it really takes all of us working together to make this happen. Our goal is to improve the social emotional well-being of young kids, but we also know it's really important to reach parents and caregivers, the providers that work with children and families, and the decision makers. So we all have a shared understanding about what social emotional development and well-being means and how to foster it. And we can use these tools that we have available to really support families in promoting nurturing relationships and also to support the healthy development of our young kids. We're doing this through 4 main objectives. The first is training. So we are We have what are called Abby's ambassadors that are around the state, primarily in central Iowa, but also providing training statewide, looking at topics like resilience, exploring emotions, handling tantrums, and offering comfort. And these trainers will reach providers, and then we'll also work on reaching caregivers more this spring. We also are working on embedding resources like books, talking points, messaging, lesson plans, and other tools and resources that can support providers in working with families on talking about these topics and supporting children with these skills. We also are working on raising awareness of the importance of social emotional development to a child's overall health and well-being. And we're measuring the impact of this work to make sure we're being effective and to really identify what messages and strategies work so we can carry those out over the next year as we look at expanding statewide. So everyone on this call plays a really important role in this effort with us and helping us talk about this topic and helping us roll this out in our communities, and really thinking about how are we prioritizing decisions and resources that will create greater support for families and providers to be able to build these skills with young children. So you're all invited to join us on January 27th for a town hall event with Sesame Street from noon to 1 p.m. It'll take place on Zoom, and details will be coming out right around the first of the year. And this town hall will really bring together leaders from different sectors, including health, education, business, and state government, to talk about the importance of this work. And so we'll share details of that soon. You can get connected through iowaallianceforhealthykids.org, and also available to help answer questions and to help connect you if you're looking for specific resources in this area. So thanks for the chance to share a little bit about this project. And I think we have a warm welcome on this slide that we'll end with as well. Go ahead to the. I think we need some volume for the video. Anybody hear it? I don't know that.
You know what, Sarah and Amanda, we'll send it out. I don't know what happened. We can send the link.
Elmo gives Iowa a very warm welcome, so you'll have to.
I know.
I've watched it. It is wonderful. Elmo, you know, in absence of your voice, thank you, Sarah. I mean, who would have ever thought, Jim Henson ever thought that these Muppets would be doing the things that they're doing? Well, you know, in the days ahead, much is going to depend on how long the pandemic-related economic downturn lasts and whether more resources for childcare becomes available. Both factors will affect how well providers perform during the crisis and their role as the economy starts to move again. If a relatively large share of providers close and move away from our childcare sector, as has been talked about today, our economy could find itself in inadequate supply as it's trying to rebuild, especially if the economy bounces back relatively quickly. A more extended economic downturn like the Great Recession that includes a protracted labor market recovery would set the childcare sector back even longer. However, the economic recovery after this crisis unfolds, parents with young children will need care in order to participate in it. On behalf of the ECI board and our ECI community, including our collaborators who presented today, I want to thank you for spending the hour with us this morning. ECI will continue to lead the effort in Iowa to make sure that every child beginning at birth is healthy and successful. Our 38 area boards are working on the ground with childcare providers every day to make sure every child in need of services is somehow touched. We're optimizing our efficiency through state funding, the use of grants, and our collaborators' initiatives. The future of Iowa depends on the down payment we are willing to make in early child care today. Each of us on this Zoom call has a role to play in making that happen. So I just want to leave you with a quote from Gabriela Mistral, who was a Chilean poet and diplomat. She says, "Many things we need can wait. The child cannot. Now is the time his bones are being formed, his mind developed. To him, we cannot say tomorrow. His name is today." So again, Amanda, Chanel, thank you for the background work. Sorry about Elmo, but tune in. This session has been recorded, so it will be available on the website. And if you have any questions, our names are on the Early Childhood Iowa website. Please get in contact with us. Thank you very much. Have a good day.